From the station that's on your side, this is Channel 7 News Daybreak.
6:23 is the time. The Little Rock Marathon is coming up the first weekend in March, and it's, of course, a race that draws thousands of people to downtown Little Rock. Some people do it to check off maybe a bucket list item. Others just want to do it for good health. And joining us this morning to break down new research about heart health and running long distance is Baptist Health cardiologist Dr. Scott Davis. Thank you so much for joining us, Dr. Davis. This is something that I know a lot of people enjoy doing. I can't relate to it personally, but I understand that people do it for various reasons, fun or health. And new research is following up on the health part, right?
And now it's in fact both. And so very interesting study and data coming out of London, the University College London, that was published in the Journal of the American College of Cardiology, our kind of Bible. That looked, just came out earlier this month, that looked at 138 first-time marathon participants.
Okay,
all right,
first time.
Right, and they took a pretty broad range, 21 to 60 plus years old. Right, average is like 40 years old, but otherwise healthy. Okay. And what they did was 6 months before they started training, they made sure that they weren't running more than 2 hours a week. So, you know, they were exercising, but they weren't full-on marathoners at this point in time. So 6 months prior to the marathon, they evaluated them with a cardiac MRI to look at artery stiffness.
Okay.
And then they evaluated them 3 weeks after the marathon, and there was a 4-year reduction in artery age. Now, how do they get to that number? It's just a formula. They took their actual age and then as a function of then artery stiffness. And it was, again, it's real enlightening, but it underscores what we've said in this segment often, and that is get off the couch and exercise. But the benefit was across the board. But here's the interesting thing, that it really benefited older and slower runners. So even though folks may say, well, I'm too old to train for this, or I'm too old to start an exercise program, actually older men and slower runners had the most benefit as far as, you know, artery age reduction. So it's all about risk reduction, right? There is no magic pill that's going to just guarantee you won't have a heart attack or a stroke or developing heart disease, but we're trying to lower risk. And this is another example of exercise being so beneficial. It's like the old adage that, you know, if exercise was a pill, it would be a miracle drug, right? Because there is so much benefit. But as we age, it's like your grandparents used to say. I mean, the arteries do get hardened. There is a hardening of the arteries. There's a stiffness that happens. But exercise tends to reduce that. And there's one observation of this study that was made that said the benefit as far as reduction in artery stiffness is not unlike adding a first-line blood pressure medicine to somebody's regimen. So, again, you know, we always caution folks, look, if you're going to embark on an exercise program, don't start training for a marathon without at least, you know, touching base with your doctor. Come see me, go see your primary care doctor. But again, huge benefit to exercise and huge benefit to folks that are going to run a marathon. We know that there have been some tragedies in marathons, and folks often ask about, you know, safety. Is it safety and is it okay to do it? But the ratio and the risk is much lower than the benefit.
Fantastic. Dr. Davis, thank you so much for stopping by this morning. Great to see you. So if you're going to run that marathon, talk with your doctor first. Maybe get a stress test if you can. Baptist-health.com for more resources and the numbers on your screen.